Which is better for hip pain, Tylenol or Advil? Or is there something better? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. When you're in pain, the last thing you want to do is wait for it to go away. You might be tempted to try over-the-counter medications like Tylenol and Advil, but are these really the best options for your hip pain? In this video, we're going to talk about those medications and if they might be helpful and maybe which one is best for your situation. Tylenol and Advil are both over-the-counter medications. They work differently, but they're similar in that they try to reduce pain and inflammation. Tylenol, also called acetaminophen, is a pain reliever and what's called an analgesic. There's a maximum dose based on your age and body weight, so you want to pay attention to how much you're taking. Advil, or ibuprofen, is an NSAID, a non-steroidal anti-inflammatory medication. It works by reducing chemicals in the body called prostaglandins, which reduce pain and swelling and fever that are released during injury or illness. But those types of medications, those NSAIDs, might not be suitable if you have certain medical conditions. Both Tylenol and Advil can help you feel better in the short term, but these medications are not meant to be used for a long period of time. Tylenol especially can cause serious side effects to your liver if you take too much. Ibuprofen and other NSAIDs have been linked to kidney issues and stomach ulcers. If you have questions or concerns about your hip pain, talking with your doctor before taking any medication is a good idea. Tylenol and anti-inflammatories like NSAIDs, ibuprofen, naproxen can reduce pain, but again, they do very little to treat the underlying injury or condition like hip osteoarthritis, a hip labral tear, and more. If your hip's not getting better with those medications within a few days or maybe a week or two, it's worth seeing an orthopedic surgeon, maybe a physical therapist who can evaluate your condition and make recommendations for treatment options that will actually not just alleviate symptoms, but actually treat the underlying condition without causing further harm to your body over time, especially physical therapy. I'm a big fan of that as sort of a better initial treatment for your hip pain. And a lot of times they can say, hey, something is bad going on, depending on how you respond to those exercises, and say, hey, you might want to see an orthopedic surgeon and a hip specialist to try to get to the bottom of this and find out if it's something really serious. Again, for most people with hip pain, Tylenol and Advil can be effective at reducing hip pain and hip inflammation. But if you have chronic pain or an injury that hasn't been properly diagnosed, isn't getting better, those options may not be the best to treat your symptoms. Instead of just relying on over-the-counter drugs, see a doctor who can really determine what type of treatment will work best for whatever your specific injury is. I'd love to hear about your hip injury. Leave that in the comments below. Please know, though, I cannot offer you medical advice. No doctor can online. But I will try to answer your question in a future video. Make sure to subscribe to this video channel. Click the bell to be notified when I release a new video or start a new live stream, including my weekly Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.